G'day Steve, we're here again at North Richmond Dentistry. We're here to discuss the case of the day, captured on the OP3D Pro. How are you, Steve?
Terrific, Sean. Welcome to Horseshoe Dentistry again, out in the country, New South Wales.
Let's have a look at this case.
Okay. This is a really interesting case for the general practitioner and more than that. So this gentleman presents with this situation. He's got terrific bone loss from periodontal disease. He's got through and through abscesses. He's got retained roots. He's got a collapsed bite. And so we really had to, from this picture, I worked out what we were going to do and explained to the patient, and he was happy to go down this pathway. And this 3D skull picture, I think, apart from a diagnostic tool for us, it's a terrific way of explaining to patients exactly what's going on in there now.
Yeah.
So I'll just go back to the actual slices on the scan to show you what's going on here. And even in the future, the options of perhaps implant work. So looking at the panoramic view here, remember this is a parallel to an OPG, but from the 3D image. We've got the retained abscesses here, terrific periodontal bone loss on the upper left, likewise on the upper right. This over eruption here and collapsed spike with terrific wear. So if I take the slice through those images, up in this upper right area you can see there's a lot of bone loss here above this cyst. Coming across, I'll just come across to the left side, and we can see straight away the large bony lesion on this very carious tooth. So the decision was made, we're going to extract these teeth, we're going to use it in doing it in theatre at Horseshoe Hospital, and we're going to issue a full upper denture after I've smoothed all the bone off in theatre. We've already restored these lower teeth here, and so the technician, when he sets up his immediate upper full denture, bread and butter dentistry, he can have a nice even occlusal plane. The next thing the gentleman asked me, what's the long-term future if I don't particularly like wearing a denture? I said, well, you've got a lot of bone there, which in the long term you could possibly think of implant therapy. On the lower jaw, you could likewise, he's got lots of options. And let's just pretend I just showed the gentleman what say around that 2-4 area, what sort of situation if you put an implant in there. So you can see it's a bit limited. I can get a dimension. Let's make this a bit bigger so it's easy to see. Yeah, I can get a dimension on the bone there. Yeah, easily. So it's a fairly narrow bone, but it's there's an adequate amount of bone if I get a density measurement which is right. I'll show you how to do that. I'll just get rid of those dimensions. I'll just go to take this off and then do a bone density analysis across there. Hang on, behave. So it's starting from the top 0 through to 11 millimetres. This is Hounsfield units. Type 1 bone's about 300 on this scale, and D5 soft bone for an implant's around about the 70 to 120. So you've got some soft areas in there, but you've got quite a lot of solid bones.
So the lower end of the blue area is where the bone's soft?
Yes, down here where it's dropped right down. It's very accurate. When you're actually putting your pilot drill in, when you're doing your implants, you can actually feel these bumps or lumps as you go down through the bone. Okay, you can keep that, and put in the database if you wish. But at the moment, so I know how much bone I've got, what the density of the bone is, and let's just sort of see if we can get a tentative implant in there to show the patient and just see what it's like. So I go to the simple system of implants, pick and place. We'll go 4.3 times 11. I think we've got a big library here. You can use I'll just put an active for the hell of it. So let's say 4.3 times 10 and see what that looks like just for hang on, 4.3 times, yep. So a touch here, what was it, up in the 2-4 area I think I said. Okay, once it knows that, this implant's not going to be big, but we'll just put it in to just demonstrate. don't like it a bit wide, that implant, so right click on it, replace the implant, and I'll go to a narrower, a 3.510, and so you can see now it's very easy to orientate. And you know, I do this in front of patients if there's a 2 or 3. If I'm doing it all on 4 or 5, I bring them back the next week. So make this small again. And remember that tooth's going to be moved, just adjust the position of it. And this could be an implant, the one of 4 for an all-on-4 on the upper, but just demonstrating that the bone's okay, we've got room to fit things in. And I'd actually go across these. Once you've healed up in 6-12 months, if you wish to go ahead with more involved treatment with an implant on this upper denture, I can show him this thing with the new scan. If you want to just put clips on 2 canine implants, or you can do it all on 4 or 5, either way you can demonstrate to the patient exactly how much bone they've got and is it plausible, and work out a price from there. Obviously the lower is another challenge, but very rapidly, perio, prosthetics, caries, restorative work, implant work, one image, and we've got the...
And it's great being able to illustrate at the time of the treatment. You know.
Oh, yeah, look, people are on board with you straight away. They can see what I'm doing on the 3D skull image. I want to do a little report, and they can take some pictures home. It's a simple thing. They can take a quote for work with them as they go out the door, so there's no mistake in what we're planning to do. They can get home and make an informed decision.
So the OP3D Pro for general dentists, great tool.
Oh, look, it's okay, there's implants one end and there's third molds the other end, but I think I wrote down there's 22 general practitioner applications between, so very much so.
Wonderful. Thanks for your time, Steve.
Pleasure.